Hi everyone, I'm Jonathan Burlison with the Nebraska SHIP and SMP. I want to talk about the differences between Original Medicare and Medicare Advantage in a little bit more detail. When we're evaluating the differences between these two options, one of the first things to keep in mind as far as differences are the monthly cost for these two options. Within Original Medicare, remember that you're going to have Medicare Part A, which is typically premium free. You will have Medicare Part B for that medical insurance, and there is a standard monthly premium for that, along with an annual deductible. Beyond that, if you choose to buy a Medicare supplement, you will have an additional monthly premium for that optional coverage. And certainly if you do have a Part D prescription drug plan, that will potentially also carry a premium. When we add up those premiums, a person could potentially be paying anywhere from maybe $250 to $350 per month with regard to decisions they make with the supplement and the prescription drug coverage. Alternatively, Medicare Advantage plans typically are less expensive on a monthly cost. The reason for this is most Advantage plans don't charge an additional premium. Most certainly a person does have to have Part A and Part B and continue to pay that monthly Part B premium. Because of that, potentially an Advantage plan makes the decision to offer their coverage at no additional cost on a monthly premium basis. That said, additional costs to take into consideration when you're evaluating these options is that out-of-pocket cost. Is there a deductible? Do I have co-pays or co-insurance I'm responsible for? So when we look at the Original Medicare structure, if you are a person who has Medicare with a supplement, let's say for example a Plan G, we would find that after a person pays their Medicare Part B deductible, typically between the Medicare Part A and Part B and that Medicare supplement, there's generally not a lot of out-of-pocket cost beyond, again, that Part B annual deductible. Whereas the alternative Medicare Advantage plans, think of that more as the pay-as-you-go structure. Potentially you have a $5 or $10 copay for a doctor's visit, maybe a $40 or $50 copay to see a specialist. With the Medicare Advantage plans, you pay as you receive services with an out-of-pocket limit. Depending on where you are and the chosen plan, that limit could exist between $2,500 up to $14,000. So it is a really big decision to make when you're looking at the differences and we're talking about cost. The other thing to think about when we're comparing Medicare Advantage and Original Medicare is that access to care. Where can I use this health insurance? So when we talk about Original Medicare is typically accepted by most providers nationally. An individual who accepts, or rather a doctor or provider who accepts Original Medicare, Part A or Part B, certainly is someone who can treat you and accept your Medicare health insurance. So with this structure, it's potentially more flexible. If you're a person who's traveling in retirement, maybe Original Medicare is a good fit to ensure you have access to healthcare outside of your local community. Beyond that, Medicare Advantage plans most certainly are a network structure. Depending on the decision you make, if it's an HMO or a PPO, there are rules to follow. HMOs are the structure of a plan that has a network where you must go to that network in order for the insurance to pay. A PPO, a preferred provider organization, has a network, and if you certainly use that network, you see lower cost and lower out-of-pocket limits, but a PPO does have the flexibility of providing out-of-network coverage. Potentially also, Advantage plans may have a nationwide network, so those are one of the things that you definitely do want to take into consideration when you're looking at your options. Am I someone who needs to access healthcare outside of my local community? Another difference that you do see highlighted with the options available, Original Medicare versus Medicare Advantage, is coverage of extra items like dental, vision, and hearing. Now, the Original Medicare structure does not cover dental, vision, or hearing on a routine basis. Certainly, if a person had a vision ailment like glaucoma, cataracts, or macular degeneration, Original Medicare would pay for those vision costs because of medical necessity. But if you're a person who wears corrective lenses to legally drive a vehicle, that eye exam is not medical necessity. Medicare would not cover that. So that's where we see the Advantage plan option providing providing some additional coverage, providing access to vision, to dental. With regard to the extras, depending on the plan, there could be a limit. Certainly there could be a network, and we really do encourage folks to do that research thoroughly, first ensuring that the hospital, medical, and drug coverage, if provided, is sufficient. And then if you get some extra benefit like dental and vision, well, that's just gravy. The decision when we're looking at original Medicare versus Medicare Advantage really should center around how do I want to access my health care, and then certainly how do I want to pay for it. If you have more questions about these options, contact the Nebraska SHIP and SMP. We're available at a toll-free hotline, 1-800-234-7119. Thank you.